So good morning. So I'm gonna perform an ABG extraction. So first things first is we check the patient's chart, obtain any information from the patient, and then once inside, of course, we introduce the patient, explain to them what's the purpose of this, such as telling them that this one is an ABG, different from any blood extraction because we're gonna extract it directly from their artery. And then this test will also check if how are they doing well with the therapy that was given and with the oxygen, and then also it will also check the blood oxygen levels from their blood. So before that, we always make sure we check the patient's ID band to ensure that they are the correct patient, and then we always make sure we do our vital signs, reassess them, patient assessment, and then once we're done, we always make sure we wear appropriate gloving. Before that, we always have to wash our hands. So after washing our hands and wearing our gloves, we always make sure we check the patient if which one is their dominant arm. So if the patient's dominant arm is on the left, we always do it on the right arm. So before that, we let the patient do a modified silence test by occluding both the radial and ulnar artery. Let the patient open and close their fist for about 3 times, and then after that we remove from the ulnar artery until we notice the color of the palms, and also we also have to observe the bonding or the pulse from the patient. Then make sure we also have something in place underneath, such as a tissue or a towel that would help hyperextend the patient's arm. And then once everything is done, if this one's modified silence test is positive, we can proceed in extracting the patient. So first is we always do clean it with an alcohol prep pad in a circular motion. So after that, we also have to, by the way, to double check everything if the supplies are complete, such as this one. So after that, we carefully remove the needle, and then we always position it with a bevel like this and holding it like a pen or pencil, and then we angle it because it's in the radial artery in a 45-degree angle. So first, carefully palpate the pulse. If we notice or sense the pulse already, carefully extract it until we insert it to the patient. So after that, we will notice some blood filling in the tube. If it fills up already, carefully remove it so that we will not prevent any accident in poking ourselves, and then apply pressure. So in applying pressure, we can apply it about 5 minutes, and if the patient is taking up any blood thinners, so we're gonna do it for more than 10 minutes. So after that, carefully remove, or even we can just puncture it with this stopper and then dispose it directly to the sharps container. And then make sure we also have another gauze in place just in case if there's tiny air bubbles or clots present. Carefully remove them. And then we also have this safety cap in place. Gonna roll it for a few seconds and then put it on this biohazard bag. And then make sure we also have this label, which include any information from the patient and also include the ventilation or their FiO2. And then we're gonna put it in here. So after that, immediately send the specimen to the lab as soon as possible. If you could not do it so, make sure we have an ice in place just to prevent this specimen to clot. So after applying pressure, I'm gonna put a band-aid and then let it stay for about 4 hours to prevent any infection. And then after that, everything should be disposed, should be cleaned up, and then with the specimen already being sent up, and then make sure we reposition the patient, make sure they're comfortable, reassess them, post vital signs, remove our PPE or gloving, and then make sure we wash our hands. And then if the patient is in oxygen, make sure we double check the device. And then once outside, make sure we chart everything what we did to the patient, and then make sure we also communicate with the healthcare staff present just for them to know, and then we're good.